Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for enuresis or bedwetting. What is enuresis or bedwetting? In ordinary parlance, involuntary urination while asleep by one over 7 years of age is called enuresis or bedwetting. That is, if a child below 7 years perform enuresis, it is not abnormal. It is not abnormal. Enuresis, the disease enuresis, occurs when a boy or girl over 7 years commits this. Soggy bedsheet, wet undergarments, and an embarrassed child in the morning. This is the picture actually. This is the total picture. And soggy bedsheet, wet undergarments, and an embarrassed child is the morning is a familiar scene in many households. This is a common. It is often a normal part of children's lives. Do adults suffer enuresis? Yes. Statistics shows about 1 to 2% of adults used to suffer from this embarrassment. However, experts believe that the figure must be more, for not all cases are reported because of social taboo. When some adult suffers, generally he or she does not want to communicate this thing to the doctors, because there is some social taboo in informing these things. Because adult person enuresis, this is something awkward. At least everyone feels that. So this statistics 1 to 2%, maybe more, maybe 4 to 5%, something like this. Is enuresis a matter of concern? Generally it is. Generally not. It is a passing phase in the lives of juniors, and almost all of them recover spontaneously. However, in some cases, medical attention is required. In seniors, it is very often a matter of concern. Generally, diabetes mellitus, prostate problem, congenital heart failure, sleep apnea, or other grave disease may lurk behind this problem. What are causes of enuresis? Overall means causes of child enuresis and adult enuresis simultaneous. But total, none cause the exact cause. Some factors are considered to play behind. Urinary tract infection, small bladder, that is size of the bladder is small, hormone imbalance, inadequate ADH, antidiuretic hormone. You know, this hormone controls our output of urine. That is, in the body, it controls the volume of blood. Sleep apnea, diabetes, nervous disorder, chronic constipation, urinary bladder dysfunction, genetics, anxiety, structural disorder such as prostate problem, many other organic problems are there. Overstress. How a case of enuresis should be addressed? Also overall. Number A is behavioral treatment. Behavioral treatment means just to control the output of urine. Here urine is passing involuntarily, so you have to control the urinary output. That monitoring fluid intake. You can monitor the fluid intake, thereby minimizing the cases of enuresis. Such as you may instruct your patient, you will please control taking water from afternoon onwards. From afternoon onwards, you please take less and less water, so that the chance of enuresis is minimized. Setting a random time alert. That is, you can instruct your patient that you please set when you go to sleep. The answer was 10. So say if you at 10 p.m. you go to sleep, then you set at 12, at 2, some random alarm, so that you are awake and go to lab. Number B is medication. That will be discussed later on. So this is the overall management of enuresis case. Only medication will not do. Behavioral treatment is required, very much required. In case of also not that only this monitoring intake and setting randomized other things also, that is not to push too much in physical and mental level, that is stress, to minimization of stress, that is also required. That is also required, because you see stress is a factor, anxiety is a factor. You cannot control genetic cause. Genetic cause is there, it is a compulsory, you cannot control it. Constipation, you can control it with proper instruction to your patient. Belladonna for enuresis. Restless sleep with sudden start of children. Start means jerk. Moaning and screaming during sleep. Involuntary urination when deeply asleep, generally after midnight or towards morning. Events occur more when they are allowed to take much sugar. Say in the night, towards evening, night, if much sugar content food is given to them, then in that case the chances of enuresis is more, which must be restricted. Conium maculatum for enuresis. For enuresis of old people, dribbling, that is passing by drop, urine, flow interrupted, urine stops and starts again, difficulty in beginning, even when standing, passing of urine even when standing, cutting and burning after urination, causticum enuresis, urine passed better when sitting, in sitting condition, patient extremely sympathetic to others' trouble, general symptoms of causticum, enuresis in the first hour of sleep. This particular symptoms is so many in are there in so many medicines and so many remedies. Enuresis in the first hour of sleep, that will be coming. Ignacia amara for enuresis. Enuresis in hysteric ladies prone to get fainted. Enuresis of children, itching and burning in genitals, urging to urinate with inability to pass urine. Enuresis of persons who cannot hold urine at all. Particular medicine is given. This is 12x ferramphos. Mind it, ferramphos 12x. You can call it a biochemical medicine, but this also on all homeopathic practitioners are free to use this particular groups of medicines. So ferramphos 12x is a very good medicine for enuresis. If this particular symptom is enuresis, person cannot hold urine at all. This symptom is also there in our homeopathic medicines, but still, if you cannot determine which one is to be given, you can give this ferramphos 12x. Acid for enuresis. Acid phos for enuresis. Enuresis is spermatoria. Enuresis in the first sleep. That particular symptom I have already told. It will be occurring in many medicines. Urine profuse, watery, milky, very much adapted to person who grow too rapidly, overtaxed mentally, physically. This is the symptom of acid phos in general. Acid phos patients are too rapidly growing persons. CPR for enuresis, involuntary discharge of acutely fetid urine. Patients devoid of love and affection for near and dear ones. Involuntary urine when coughing, sneezing, laughing. Last two symptoms are general symptom of CPR. That is, in all CPR patient you will get this symptom. Cantharish for enuresis. Enuresis of children with severe burning, tremendously painful urination, urine scanty, cutting, burning, extreme dysuria. Dysuria is difficulty in passing urination, excitement during pain. Mind the symptom, excitement during pain. I have noted this symptom as USP, uncommon, strange, peculiar. I have throughout my videos I have mentioned this USP terms very much, many times, and I will also in the coming video I will mention this because this is a very important point. USP, the full term is uncommon, strange, peculiar symptom. One particular symptom can give you the right to select a particular medicine if that matches. One part, you cannot match the whole symptoms. Benzoic acid for enuresis. Nocturnal enuresis. Nocturnal means nightly. Urine high color, irritating, smell like that of horses. especially in children and growing adults. Silesia for enuresis, problem strictly worse in new moon or full moon. Enuresis of children suffering from worms and chorea, constant desire to urinate. Now what is chorea? I have given a picture on the right hand side. Saint Vitus dance, Saint Vitus dance or Sydenham chorea or simply chorea. If you look uh, from outside, you will think that particular girl, maybe male person or boy, that's as if he is dancing or she is dancing, but this is not dancing. This is a neurological disorder. Neurological disorder, and where the extremities, legs, hands, limbs are actually these are in jerky condition. This is a disease. The patient is suffering from pain. This is called chorea. Silesia is a very good medicine for chorea. Naturally, in Silesia, I have mentioned the particular term chorea. With this, the video ends. Thanks for listening and viewing. If you got anything to say, please write down in the comment section. I would certainly respond.